Hey guys, welcome back to the channel. It's Paramedic Mat. Today's video subject is my home medical kit organization. So it's gonna be a free video series. In the first video we're gonna see this bag, which is the main jump bag I got. Then we'll see the oxygen bag and then all the specialty kits I have home. So these bags are intended for any motor vehicle accident that may happen in front of my house, or for any medical emergencies someone may have inside my house. So this bag is a Dimatex reflex bag. It's got some nice pouches, super resistant. We actually use these on the ambulance, so I just got the same we use. On the outside pouches you're gonna have everything for reanimation purposes. So as soon as you open this pouch here, you're gonna find your AED, which is a Welsh Allen, as well as defib pads. In addition to it, you're just gonna find a burns kit. So in this green pouch here, I just got one burns kit with two different sizes of burn shield, bandages, sterile gloves, and sterile fields to patch a burn, a severe burn, as well as a section member kit. So if someone gets their finger cut off or something, I got some instant cold packs, sterile fields, and saline to keep it fresh until we can drive them to the hospital. Then in the second front pouch, we're just gonna find gloves right there. We're just gonna have a lot of gloves because that's the first thing you're gonna want to do, as well as a bag of mask. So it's an Ambu Spirit 2 with the mask still in the wrapper. And then this PVM is going to be able to get connected to the oxygen. Oh, there we go. Then on the sides you're just going to have some personal protective equipment, so a sharp shuttle, some hand sanitizer, flashlights, gloves, and the X shear trauma shears, which are awesome. There you go, that's just on this side. And then on the other one you're gonna find everything you need for suction. So I just got a manual suction device, suction pump with some catheters, and two different size bags, masks for the Ambu bag. There you go. And as we dig inside the bag, we're gonna find a lot of stuff. So as you see, I got a whole lot of different pouches, so we're gonna review them one by one, starting with bandages. So this is just a small kit with a lot of different bandages, so co-wrap, co-band, and I have lots of gauze, normal saline, disinfectants, different kinds of disinfectants, and just a lot of ABD pads, big dressings, gauze pads to disinfect wounds, and just some small band-aids in case someone gets hurt. The second kit we're gonna have, and the reanimation part, is medications. So I just get this pouch from Tasmanian Tiger, in which I got all the different medications I'm gonna use. So some glucose to, in case I need to make some dilutions, or to put sugar back in someone who has a diabetic emergency. I got some burn cream, and then I got a few different medications here and there. I just get some hemostatic gauze for severe wounds. Then I'm gonna have some burn gel right there, some salbutamol, so albuterol for the American public, some paracetamol, codeine right there. These are codeine as well, and these are morphine concentrated. Then you got tea tree oil for dental pain relief, some glucose gel oral to maybe put sugar back in someone who is hypoglycemic, and just normal saline in case you need to make dilutions. So there you go for the medications pouch. It really covers the basics, because this kit is just intended to practice care until the ALS ambulance arrives. The next pouch we're going to find is the IV module. So this is one of the bigger pouches because I need to carry a lot of stuff. So in there we're just going to find an IV start kit, package with everything I need to start an IV. So I got an 18 gauge catheter, tourniquet, disinfectant with some gauze pads, a tegaderm, IV tubing, and a 250 pouch of normal saline. In addition to it, I'm gonna find a whole lot of different sized catheters. So we got 24, 22, 20, 18, and 16 gauge catheters, all secured to start an appropriate IV. Then in there, we're just gonna find some additional stuff in case I need to start a second IV. So we're gonna have right there some disinfectant with gauze pads again, some hand sanitizer, tape, Coban, some freeway stopcocks, as well as additional tegaderm dressing, more J-loops and freeway stopcocks, and then the transparent wrap right there. I just got 2 more tubing, 2 500cc bags of normal saline, and 2 saline flushes at the back right there. So that's going to allow me to sort multiple IVs in case I need to, for example in the case of dehydration or cardiac arrest, cardiogenic shock, all the situations where I need to put fluids back in somebody. The next kit is going to be airway management. So as far as airway goes, I chose not to include any ET stuff because I don't have any sedatives to go with it. So I just got different size OPAs, so oropharyngeal airways, as well as a simple MAC laryngoscope right there, and McGill forceps to go find something stuck in the airway. Now I just got a set of chest seals right there with some betadine to make them stick better, 10cc syringe, maybe to complement any section needed, lubrication jelly here, as well as glasses for personal protective equipment. So there you go for the airways part. It stays really basic because where I live, I can expect an ambulance to come within the next 10 minutes. So this is enough. I then got the diagnostics pouch, in which I got a thermometer, which is going to be used for taking the temperature within the ears. It's super precise, so I really like it. The old stethoscope, as well as BP cuff to listen to heart sounds, lung sounds, and take blood pressure. Then you're gonna find just some tips for the otoscope. I got it right there. So this one does pupil gauge and otoscope this way. You just get additional tips for it. Same thing for the thermometer. Then you're just gonna find a pulse ox right there, and a blood glucose tester. Presents this way. There we go. This way I can get a full size of vitals. Also get backup pupil gauge power lamp, and this way I'm gonna be able to start diagnosing. So any vital problems, for example hypoglycemia or any kind of infection, you know, it's really good to just get a temperature, get a heart rate to see if your patient is not going into sepsis. The last 2 kits are going to be the trauma pouch, which is really for orthopedic injuries. So we got a splint set with different sized stem splints, cold pouches, Coban, more cold pouches, and triangular dressings. And the last one you get is just the hemorrhage control one. So you get 2 cat tourniquets, 2 Israeli dressings, 1 more pressure dressing, and 2 packs of packing gloves. So there you go, guys. That's everything that was in my bag. The only additional thing I carry is an emesis bag, just in case you need an additional one. It's going to allow you to have a clear scene to work. So there you go, guys. I hope the video wasn't too long. Stay tuned for part 2 and 3, and have a nice day. If you have anything to say, see you in the comments. God bless y'all.